Hey guys, welcome to another episode of Our Ketogenic Life. We're happy to have you here, and we are recording this a few days before Valentine's Day. So, what we thought is we would take this time to kind of do a little deep dive into your heart health, some tests that you can do that's probably not being done on you right now, so that you can get a clearer picture of your cardiac risk factors and what you can do about it. And we're hoping that this will give you some insight so that you can have a healthier heart. So, before we get started, I just want to remind you we are transitioning from a fully ketogenic type conversations to a whole health type conversation. And it's going to be switching over pretty soon to a different title for the podcast. It's going to be called Kevin Davis Health. And we're going to cover a lot of different subjects as like we've been doing in the last several months. We're still going to do ketogenic things as well. So for those of you that are doing ketogenic, you're going to still get information. But we're going to give you some more information, some more details, so that you can live a longer, healthier life. So that coincides with the release of our book. The book has been released. It is currently on Amazon. We will provide some show links in the show notes so that you can click on it and go there and get your copy. And hopefully it'll give you some information. I did a Clubhouse interview today with a friend of mine called, his name is Cliff Ravenscraft. If you are on Clubhouse, it's on his replay, so you'll be able to get a lot of information as far as, kind of things that's in our book. And we're going to get a link to that and post it here or on our Facebook page or on our mailing list. So if you are not on our mailing list, make sure that you send us your email. I'll get you on the list so that you can get up-to-date information, things that we release that will let you take a deeper dive into your health. So the book is called Young and Strong at 40 and Beyond, just in case you can't get to the link or there's a problem there. And if you just go on Amazon and type in Young and Strong at 40 and Beyond, you'll be able to get a link to that. And right now, for some reason, Amazon is having it on sale. I don't know why. They've marked it down. It's regularly going to be $19.99 and it's currently $5.99. So now's the time to get it. Dealing with Amazon is very cumbersome sometimes, and they responded to an email saying that they do this occasionally for certain books to help promote them. So we appreciate that. So it'll be a benefit for you to get that book now. So let's turn our attention to the subject of your heart health, and some of the things that you can do to monitor your risk factors, and some of the things that you can do to help alleviate and decrease some risk factors. Now, the question is, why are we concerned about your heart health? Well, the number one reason probably is it's the number one killer cause of death, across the world. It's counts for 30 to 40% of all deaths, and it also causes, that's mortality. And morbidity is the problems that it causes that isn't included in the death figures. Things like kidney disease, breathing problems. If your heart is not pumping like it should, you're not going to get the oxygen around. It's associated with dementia, having cardiac risk factors. And the one thing that I think you really need to take home from this is a lot of the things that I just mentioned, like the dementia, and then you're talking about diabetes, you can throw that in there as well too, and heart disease. They all have common factors as far as the cause of those. And the things that we've talked about many, many times before is the inflammation and the insulin resistance. So, we're going to talk about correcting some of those issues along with some more specific treatments for different reasons for heart disease. So I just want you to know that, doing these things is not just for your heart, it's for other things as well. So the three things that we're going to talk about basically for heart disease is, as far as the causes, is endothelial dysfunction, inflammation and cholesterol. Now, endothelial dysfunction, basically it's just the inside lining of your vessel walls. And that's where all the damage is being taken place. Now, atherosclerosis, most people think it's kind of like if you have a, in your sink, you got the drainage tubes go down, and they think, you get something stuck in there. That's the way they think that the cardiovascular disease is, like when someone has a blockage. But actually, most of the problem that takes place is within the arterial wall. And we're not going to go into that. That has to do with a lot of different types of cells. There's cells called foam cells, and it causes inflammation and it gets oxidized. We're not going to go in with that with this conversation, but just remember that it's within the vessel walls that's causing the issues. So when we talk about cholesterol is important, but it's not the most important thing that I think it's other factors that is causing this problem within the vessel wall. So what we want to do is talk about, basically a lot of this is going to be talking about like prevention. There's a lot of risk factor scores that you can get. One's called a MESA score, and I use that for my online clients as well. You put numbers in as far as like cholesterol, whether they're diabetic, their age, whether they're male or female, and so on. And this MESA score gives you a indicator as far as the risk for cardiovascular disease in the next 10 years. The problem with that is it doesn't start until you get to be age 45. So, if you're age 40, well, yeah, you still need to worry about this. Actually, if you're age 20, 30, you need to be kind of concerned about this and start doing some of the things we're going to talk about so that you can be heart healthy. Heart disease does not happen overnight. It is a process that develops. And what we want to do is identify some of these things that's going on, some biomarkers in your blood that you can do to kind of figure out if these things are attributed to you, so that you can kind of get started on treatment options now. So first thing we're going to do is talk about causes. Causes of heart disease. First thing we're going to talk about is the endothelial dysfunction. And some of the things that can cause problems with this is having long-standing hypertension. It can damage the vessel wall. Certain toxins can cause stress at the cell level. I talked about insulin resistance. Insulin resistance is something that causes the endothelial dysfunction. Cholesterol, obviously that's going to cause some of the problems as well. Chronic inflammation, we've mentioned that many, many times. And then there's another thing called TMAO. It's a blood test, but what it does is it shows it's associated with the bacteria in your stomach, and if you have this elevated, it can lead to some of the endothelial dysfunction like we've talked about within the vessel wall. Cholesterol, you can have problems with excessive production. Surprisingly to a lot of people, is your body produces most of the cholesterol that's in your body. It is not taken by your intake of your food. With cholesterol, you can also have excessive gut reabsorption. I have that problem as well. I have some genetic problems, and that's one of the reasons my cholesterol was elevated. I've done some things with my diet, and then certain medications, and it helps bring that down. Some certain supplements. You can also have poor serum uptake by the liver, and a lot of the new medications, the PCSK9s, those are the ones that are injectable that bring down your LDL, and they are indicated for heart disease if you've had a heart attack. The other thing is that causes the heart disease is inflammation. Obviously, inflammation, we've talked about that before. And a lot of foods can cause inflammation. Your gut microbiome, if it's not where it's supposed to be, that can cause inflammation. And then stress, stress to your body, whether you're not sleeping well, whether you're eating the wrong kinds of foods, or whether you have an emotional stress. All that can lead to having problems associated with heart disease. So when we talk about heart disease, we talk about endothelial dysfunction combined with abnormal cholesterol. I'm going to go a little bit more on that in just a few minutes. And then inflammation. You take these three things, and over a period of time, that's when you have development of this of heart disease. So if we want to decrease our risk for heart disease, we have to address all three of these issues. We can't do anything about time. Time is going to pass. So what we have to do is concentrate on these three things and see where we're having problems at. And we're going to go over some lab work in just a second so you can know what to monitor for these specific three things that we're going to talk about. Now, risk factors, you think, okay, so big deal. We've got these things. How much more of a risk do I have if I have these problems? Well, one of the tests that we check for inflammation is called your CRP, and more specifically for your heart, it's the highly sensitive CRP. It's little h, little s, and then capital C, capital R, capital P. If you have a highly sensitive CRP that is greater than 1, then over 5 years you have increased risk for heart disease over 400%. There's a blood test that we're going to talk about here in just a second. We call it your plaque test. It's LP/PAL2. If you have this elevated, increased risk factors for heart disease over 200% over 5 years. And for the endothelial dysfunction, where all the blockages has taken place within the vessel walls, there's 2 tests. It's called ADMA and SDMA. We're going to talk about those again in just a second. You add 200% risk factor for heart disease over 5 years. And then there's a test called your microalbumin. If you're diabetic, you probably get this once a year, but it's also good to do this on other folks as well too, because it can be associated with heart disease. And if this is elevated, you increase your risk of 300% risk for heart disease over 5 years. So obviously, those are pretty significant numbers. If I told you to increase your risk for 10%, that's one thing. But we're talking about 200 to 500%. Or 400%, that's huge numbers, and there's things that we can do to get this down. So what we want to talk about first of all is a test. Again, we're not going to go to the pathophysiology. I don't think you really need to know that. It can get complicated, but I think knowing the test, and I'm going to put a list of all these tests at the end of our show notes so you can have these, and you can see if your insurance will cover some of these, and if your provider can order these for you to kind of get an overall sense of where your cardiovascular risk factors are at. So the first thing we're going to talk about is the testing for the endothelial dysfunction. I mentioned something called ADMA and SDMA, and basically that's called asymmetric dimethylarginine. Now, why is this important? When you have these two that are elevated, what it does is it gives you an indirect measurement of nitric oxide production. Now, what is nitric oxide? I'm sorry about speaking on that. Nitric oxide, what it does is it vasodilates. It makes it bigger, your vessel walls. So when you have lower nitric oxide production, your vessel walls do not expand like they should. So if you have an elevated ADMA, it's associated with hypertension, insulin resistance, and hyperlipidemia. Elevated SDMA, you have reduced renal function, so it has to do with your kidneys. And you're going to find that there's another test when we talked about it just a minute ago, which your microalbumin has to do with your kidneys as well too. There's another test I do almost on every one of my patients, is called a homocysteine. Homocysteine is associated with heart disease. It's also associated with dementia. So what it is it's just a transfer of a methyl group, which is a carbon and hydrogen. Again, you don't need to know the specifics about that. But basically, when you have elevated homocysteine, it's associated with heart disease. The reference range on a lot of testing is from roughly from 2 to 15. Ideally, you want this less than 8. And if you've heard us talk about blood work before, there's a difference between a reference range and an optimal range. A reference range is just the average of the testing that they're getting from folks across the United States. And again, I've made the comparison, like if you're at a football game and you have 100,000 people there, if you look around, there's a lot of people that look unhealthy. You don't want to be in that group. You want to be in the optimal range. So your homocysteine, we want it to be less than 8. For every time you have an increase of 5, as far as the number is above 10, for homocysteine, you have a 1.8, almost a 2 times greater risk for heart disease just associated with the homocysteine. Now, there's a thing called methylation, and if you're interested in this and how to get this down, there's actually a chapter in my book about methylation, and it has to do with getting your homocysteine down. There's other things that you can do as far as like choline, but again, that's more patient specific, so we won't really get into that right now. But methylation with B vitamins, getting special vitamins that are called methyl B12 and methylfolate are key treatments for this. And then the last thing for testing for the endothelial dysfunction is the microalbumin. I talked about that before. It's just measuring protein in your urine. You're supposed to have some protein in your urine, but if you have too much, it's just a sign of a kidney disease. And getting that can indicate some endothelial dysfunction. So, inflammation. Again, we've talked about inflammation many, many times on this podcast. There's the HSCRP, the highly sensitive CRP, and that's the C-reactive protein. That's something that is very common, and some of the sources of inflammation you can get is from insulin resistance, leaky gut, certain foods. I find gluten and dairy to be a big factor as far as causing inflammation. It's an acute phase reactive agent made in the liver. It has a half-life about 24 hours. So the first thing I do is if someone has elevated highly sensitive CRP, we want to make sure that it actually has to do with what we're concerned about is chronic disease. Again, this is something that happens acutely. So if you have some injury, it's going to go up. So if you exercise real hard, it can actually make it go up even if you do it the day before. So if someone has a high HSCRP, what we want to do is recheck that, and just to make sure that it is actually high. Another test that we check is fibrinogen. Fibrinogen is something that has to do with the platelet aggregation and coagulation. So it means like how your blood forms clots. So higher risk factor if it's over 333, and this is milligrams per deciliter, so make sure your units are the same on your labs. You have a 2 to 3 increased risk factor for heart disease just with the fibrinogen. We mentioned a test called your plaque. Your plaque test is it's associated with plaque formation in the vessel wall. So if this is already elevated, then it could indicate some presence of plaque already forming within the vessel wall, and it has an increased risk factor for over 2 times for 7 years for heart disease. So lastly, let's talk about, we talked about inflammation, we've talked about the endothelial dysfunction. Let's talk a little bit about cholesterol. Now, cholesterol, if you follow cholesterol, like I follow people who comment on cholesterol, there's a lot of questions as far as cholesterol and heart disease. I do think it has an effect with heart disease, but I think we're looking at the wrong things. If you just do a standard cholesterol test, usually you get back 4 numbers. You get a total cholesterol, you get triglycerides, you get your HDL, which people call your good cholesterol, and LDL, which is called your bad cholesterol. Now, the LDL that's called with your bad cholesterol, I think there's more to it than that, and I'm going to explain that in just a second. There's 2 different numbers that I look at with your LDL. We do an advanced lipid test. It's called an NMR. And when we do this test here, actually I need to write that down and make sure I put that in the show notes as well. It's an advanced lipid test. And what it does is it breaks down your cholesterol a lot more specific as far as indications for risk factors for heart disease. So what I'm talking about, there's one called your LDL-C, and that's your concentration of your LDL particles. And when we talk about particles, we're just talking about particles of the cholesterol. And there's one called your LDL-P, and that's the actual number of particles. And the easiest way for me to explain this is you have to figure out what your end goal as far as doing a study is. So let's say our study is that we want to measure cars and car congestion and wreckages on an interstate. Okay? So your concentration is the people in the cars. It's not the number of cars, it's how many people are in the cars. Your LDLP is your particles. That's the number of cars. So the cars are kind of carrying the people. The LDLP particles are kind of like carrying the concentration of the LDL particles. So if your end result of trying to figure out accidents on a freeway, you really don't care about how many people are in the car. What you're concerned about is how many cars are out there. And that's what the LDLP particles shows. There's another test that's associated with LDLP particle, and again, I get this on most of my patients. It's called your ApoB, and that's just a better measurement as far as these how many cars are are on the interstate. And again, that's what we're kind of worried about. Now, it gets a lot more complicated than that, but that's the easiest way I think to explain it, to kind of give you an idea of what we're talking about. So with your LDLP, just a second here, your LDLP particle, it actually, and the ApoB, it actually reflects the number of atherogenic particles, and it doesn't have anything to do with the mass or the number of people in the cars from my example. The LDLP compared to the LDLC, the particle versus the concentration, and just remember P is what you really want to look at, not the C after the LDL, is 30% more predictive of cardiovascular disease than your basic lipid profile. So if you have somebody who has similar LDL-C numbers, and again, that's the number of people in the car, that's the one that we're really not that concerned about, and you have different LDL-P scores, your outcomes and your risk factors are much different. So, you know, if you have one person in a car versus 5 people in a car, and all you're doing is checking the number of people in the cars, the people that you're associated with the higher risk factor is the number 5 people in the car versus the 1 person in the car. But that's not what really is causing the accidents. The accidents are the cars on the interstate. Hopefully that's helped. Again, that's a very complicated very complicated process. If you go into deeper dives on cholesterol, it can even get so much more confusing than that if you don't have any experience with it. But for the layperson, I think that's a good starting point, is trying to figure out why are we measuring different things. And again, research is going on and on. So just because we see this now doesn't mean it may change in the next 5 years. But I follow some people who really look at this stuff and do a lot of studies. And that's where I kind of go with my with my treatment, is looking at these advanced lipid testing. So we figured out, okay, the 3 things that causes heart disease is endothelial dysfunction, cholesterol, and inflammation, and this happens over time. So what can we do to help with treatment? You know, this is probably where you're probably more interested in. So to treat the endothelial dysfunction, again, when you have hypertension causing the problem, you need to control your hypertension. Well, how do you control hypertension? Well, obviously, we go back to our 4 pillars of health with our diet, or with our book and our coaching. You got a healing diet, you got exercise, you got sleep, and you got prayer. You need to get those things in place, and that will help. It's amazing, and I can't remember the study, but there was a study that came out that showed people who have had hypertension went on a lower carb diet, how much more their blood pressure actually improved. Some of the other things that you can do to help with high blood pressure is you can do sauna treatment, you can do cold therapy, you can do, again, what we talk about, prayer, meditation. So those are some of the things that helps if hypertension is driving the endothelial dysfunction. If you have toxins, now this really gets difficult because you really need to have somebody knowing what they're doing. You don't just do a detox where you drink something and you have loose stools for a couple days and you're okay. That's not a detox. The problem is at a cell level, and if you don't treat the cell level, then you're not really doing a detox. If you're having toxins, it's a major issue, can cause a lot of health problems, with one of them being cardiovascular disease. You can also have insulin resistance. Insulin resistance, obviously, the problem with insulin resistance, the causes of that is usually eating too much, eating the wrong kinds of foods. And again, it goes back to our 4 pillars of health. One of the things that really helps with that is lowering your carb intake, and then also fasting. Incorporating those 2 things into your lifestyle can help. A lot of people think about fasting just with weight loss, but there's so much more information that's coming out as far as fasting and its health benefits, not only with like cardiovascular disease, but also with things such as increasing your health span, being able to live longer, healthier lives because you're doing some things to help clean up the body. If you have chronic inflammation, again, we've talked about that so many times. 4 pillars of health is really where you need to get started with that. And then lastly, we mentioned something called TMAO, and that's something that's produced in the gut. And you want to be able to look at your genes. I think looking at your genetics helps figure out what treatment is best for you. But you want to be able to decrease your choline intake. Choline has a lot to do. There's certain things like eggs that have choline in it. And especially if you have certain genes that, like the APOE that I mentioned in previous podcasts, not the APOB that we just talked about. That's a different one. APOE, if you have genetic problems with that, you definitely need to decrease your saturated fat intake. So if inflammation, so we talked about endothelial treatment, now let's talk about inflammation treatment. Again, we want to look at where is the source of inflammation. Gut being one of the major reasons why people have inflammation that they can't really figure out where it comes from. When you have inflammation in your gut, it can affect so many different things in your body. Your oral health, there's things as far as like chronic infections in your gingiva tissue, chronic cavities, things like that. That can be a source of chronic inflammation. Diabetes, diabetes, getting that under control. Again, and then also autoimmune. Autoimmune can cause problems as far as inflammation, and things like what we're talking about there is like lupus, autoimmune thyroiditis. You can have rheumatoid arthritis. Those are the issues that you can go over. And lastly, cholesterol. What can you do about cholesterol? Well, there's different things that's causing cholesterol problems. Like if you're having excessive production of cholesterol, you want to look at your genetics. You look and see if you have any kind of genetic disorder, because again, if you have a genetic SNP where you have an APOE gene that's abnormal, then you want to limit your saturated fat, eat more monounsaturated fat. You want to watch your sleep, your exercise. Again, the 4 pillars of health go into that as well. And then also sometimes certain medications can help. There's statins out there. Again, there's controversy over statins as well, as far as their effectiveness, as far as preventing heart disease. But one thing I know statins do is if you've had a heart disease, it really helps preventing you from having a second one. But you need to talk to your provider about that as far as like the best treatment options for you. So hopefully that's helped. Hopefully that wasn't too much. Again, in the show notes, I'm going to put the labs that I mentioned here, and you can take a look at those and ask your provider to get those, and just kind of see if those are things that are elevated in you, and that you can maybe start tackling some of these causes with these treatments that we talked about for certain ones. And then you're going to be able to lessen your risk factor for heart disease. So if you've had family history of heart disease, a lot of people think, well, my dad, my grandpa, my mom, whatever may be, had heart disease. What I want you to do is walk away from here thinking that there's some hope. There's some things that you can do differently. And the earlier you start these things, the earlier you know about these things, the better off you're going to be. I'm not waiting until I have a heart attack to start making some changes, which I've already done. I want to do that as soon as possible so that I can live the healthiest life that I can, again, while we're here on earth. So let's turn our attention now to our catechism. our catechism today is, what did God the Father undertake in the covenant of grace to justify, adopt, and sanctify those whom Christ should die? So with grace, that is getting something that we don't deserve. Grace is something that God gave to us that we didn't deserve. There's nothing that we did that deserves Jesus going on the cross, dying for our sins. He did that on his own. He gave that gift to you, and he gave it to me. But you have to accept those things. It's something that, the gift is there. It's like if someone came to your house and they handed you a gift, you have to take it. You have to receive it. And that's the same way with God's grace, God's gift to us, is he's done it for us, but we have to receive it. He's not going to force it on us. He wants it to be a decision that we make on our own. And I know for me and for Danae, that has been the best decision we've ever made. So that wraps up Valentine's Day and what you need to know about your heart disease, and as far as some of the things you can take, from this to get started to improve your symptoms. Remember, our book is out, Young and Strong at 40 and Beyond. If you are associated with Clubhouse, we did an interview with Cliff Ravenscraft, mentioned that, and there'll be a replay on that, so you can go in there and listen to that. It gives you some ideas about the book and some of the things in it that may be beneficial for you. But we're going to go now, and you guys remember, be fit and be faithful.